else wish to speak in support?
Mr. Chairman, members of the subcommittee, Jeff Caruso with the Virginia Catholic Conference. We brought this proposal to our two Catholic school systems in Virginia. We've got the Diocese of Richmond and the Diocese of Arlington. And together they run 80-some Catholic schools. Their perspective is that this bill would very much save lives, and as a life-saving measure, we feel it's very important, and we feel this is the appropriate way to go about it. We are very mindful, too, that there are the existing exemptions which apply across the board to vaccines and would apply to this one. So we think that this proposal strikes the right balance, and we would very much hope that it would go forward to save lives.
Thank you. Anyone else?
Hi, Becky Bowers, I'm here with the Virginia Association of School Nurses. Our members are employed in public and private K-12 programs throughout the state. I've never been a school nurse, but I have been an ER nurse, and I've never seen a person with meningitis, and I'm thankful that I've never seen one, because the devastation to the person is very bad, and to the family. And I hope that we will require this for children in the Commonwealth. And on behalf of my nurses, the same way.
Anyone else wish to speak in support? Does anyone wish to speak in opposition to the bill?
Chairman, I'm Steve Martin. I represent National Vaccine Information Center as well as Virginians for Health Freedom. I have a fact sheet I'd like to make sure we get in each of your hands, as well as the primary reason that I'm standing before you right this minute is to introduce the first speaker. I think we'll have several we can easily handle within, well within 15 minutes. I want to make sure you have her credentials before she speaks. And then if possible, Mr. Chairman, I'd like to take about 1 minute, 75 seconds when we wrap up again.
I'm hoping 15 minutes.
Yeah, that's right. Mr. Chairman, I would hope that you would focus down on the actual serotype and the individual cases that are actually affected by this vaccine. And realize that we right now are below national average as a volunteer. The vaccination, even though it is voluntary, we are at 71% and rising, and not that far away if we continue from being able to be at herd immunity in Commonwealth of Virginia. But I am going to leave the more technical stuff, if I may, to Vicki Kebsworth, who is the Director of Research at the National Vaccine Information Center. Her doctorate is in public health. Previously, she was a health policy analyst for the U.S. Congress. She has served on 4 federal vaccine policy-making panels at the FDA, the HHS, and the CDC. And so if you would, she's going to be our primary speaker, and very few others will be also making comments, including from Virginians for Health Freedom. Vicki.
Good afternoon, and excuse me for my voice. As Steve said, I'm Dr. Vicki Kebsworth, and today I'm testifying on behalf of the 200,000 supporters of the Virginia-based National Vaccine Information Center. NVIC opposes HB 644, a bill that would require all Virginia children to receive 1 dose of MCV4 meningococcal vaccine in order to enroll in 6th grade in a public or private school. We note that the state already mandates that college students receive meningococcal vaccine. We oppose HB 644 for the following reasons. First, invasive meningococcal disease is very rare, and it is not easily transmitted in public settings like schools. 99.9% of people asymptomatically colonize meningococcal bacteria in their nasal pharynx, and they, as a result, will develop lifelong immunity. Only individuals with rare genetic variations and other risk factors are susceptible to invasive disease and very tragic loss of limbs and death. Transmission requires close personal contacts, such as exchange of saliva through kissing or sharing a toothbrush. Second, invasive meningococcal disease has been declining for decades in the U.S. and in Virginia. Before the adolescent vaccination program started, the incidence of invasive disease declined by 64%. In 2016, in the U.S., there were 372 cases. In Virginia recently, there have been 10 to 12 cases of invasive disease per year. The Virginia incidence rate in plain English is 1 in a million. Third, a second MCV4 mandate is very unlikely to prevent invasive meningococcal disease and deaths. There are 12 meningococcal strains that can cause invasive disease. The MCV4 vaccine only contains 4 of these, A, C, W, and Y. In 2015, only 3 of the 10 cases of invasive disease were in children 10 to 19 years of age who would be subject to the mandate. According to the CDC, none of these cases were caused by A, C, W, or Y. As a result, an MCV4 mandate for 6th graders could not have further reduced a 0 incidence of relevant invasive disease. The proposed mandate won't protect against B strain infections that cause the majority of disease in the U.S., and CDC does not recommend the B strain vaccine for all children because it is not cost effective. Additionally, CDC reported that the mortality rate for invasive C and Y disease was the same for vaccinated and unvaccinated persons, and that MCV4 antibodies will wear off in 2 to 5 years. Fourth, MCV4 is expensive, depending on where the vaccine is administered. The public health clinic, doctor's office, or pharmacy, one dose costs between $89 and $159. Fifth, more than 71% of Virginia's children are voluntarily taking the MCV4 vaccine, and achieving high uptake rates do not require mandates. Every year, voluntary use of MCV4 vaccine among Virginia teens increases, and as of 2016, it exceeded 71.5%. 3 states without mandates, Wisconsin, Maine, and New Hampshire, have voluntary uptake rates above the national average of 82%. Lastly, MCV4 strain vaccine causes reactions, injuries, and deaths. Vaccine manufacturers list serious MCV4 reactions, including brain inflammation, convulsions, paralysis, Guillain-Barré syndrome, and death. The Federal Vaccine Adverse Events Reporting System contains reports for more than 19,000 MCV4 related injuries, including 59 deaths. 400 of those reports came from Virginia. 34 of them came in last year. I would just like to say, this report from VAERS does not cover all 6 of the vaccines, meningococcal vaccines that are licensed. These statistics apply only to the MCV4 vaccine, which was licensed in 2005. 2 brands of licensed MCV4 vaccine are widely available to all who want it, and many are voluntarily taking it. Because invasive meningococcal disease is very rare, a new mandate will prove to be costly and ineffective in reducing a near absence of invasive disease caused by strains in the vaccine and strains not in the vaccine. The scientific evidence does not support an additional MCV4 mandate that will create a new barrier to children attending school in the Commonwealth. Thank you for the opportunity to speak on behalf of NBIC and our supporters.
Thank you, Representative. Anyone else wish to speak in opposition?
My name's Will Shaw. I don't represent an organization. I live in Louisa County. I don't represent an organization or a professional group. I'm a taxpayer, a parent of 4 children, but my kids are well beyond the school vaccine age. I stumbled across this bill just in poking around the LIS, and my first thought was, another vaccine mandate? I mean, we seem to have gobs of them, and there seems to be no end of it. Just because a vaccine exists doesn't mean it's necessarily a good idea to mandate it. I mean, a lot of people get the vaccine voluntarily, apparently most people. But the disease, the 4 strains purported to be protected against by this vaccine, they're not in a remotest sense very common in the Commonwealth, and it just seems kind of goofy to mandate take away the prerogatives of parents working with their pediatricians in this matter. And plus it's gonna cost the taxpayer a couple $1 million a year. Thank you.
Thank you. Anyone else wish to speak in opposition?
Yes, I'm John Hanks, Virginia Spell Freedom, and we oppose mandating the vaccine.
Anyone else?
Yes, I would like, I'm Françoise Nolan and I have a medical degree. In the beginning, I always believed in vaccine, and then when I started looking into the vaccine, now we are vaccinating for children that cannot get those diseases, so I started looking into it. This vaccine has a 15% rate failure, and who are going to be the children that fail to respond to the vaccine? It is probably the same children who would have gotten the disease. So I don't think that this vaccine is going to add any protection. Also, if you go look into VARS, there are some children who are who have developed paralysis and also we have developed the same disease, the meningococcidia, from the vaccine, just a few weeks after the vaccine. Some vaccine can facilitate the disease, and maybe that is the case, like in the Philippines, we have the dengue vaccine scandal. It's because you give the vaccine and then it facilitates the disease into those students, into those children. Also, we do give several vaccines at the same time, and the side effects do not just add. It's just not 1 + 1 = 2, it's 1 + 1 = 10. You increase the risk of all those toxic working together when you give several vaccines at a time. So the more the list, the longer it becomes, the more you're going to give vaccine at the same time. We don't have any study that studied